Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.
Recent statistics revealed that a third of South Africans are smokers. However, more than half of smokers had tried to quit numerous times, and the number one reason for quitting was a desire to live a healthier lifestyle. Dr. Darren Green agrees with this sentiment and explains just how unhealthy smoking is.
Smoking affects the body in different ways. There are short-term and long-term side effects. The products that are deposited are considered tar, which is the carcinogen, which leads to cancer, predominantly lung cancer. And then, of course, you have the nicotine itself, which is in tobacco, which also has long-term side effects on the alveoli, which are these pocket structures inside the lung tissue. And then, of course, we have the long-term sequelae of smoking, which affects the cardiovascular system by predisposing or even accelerating the process of what we call atherosclerosis. That means the hardening and the deposits of fat on the inside of the blood vessels, which leads to narrowing of the blood vessels, and with that, obviously, increased heart disease, increased stroke, and obviously with the thrombosis. So those are the mainstay of causes of death when it comes to smoking.
One of smoking's major disadvantages is that it not only affects the smoker themselves, but can also have negative health effects on a smoker's family and friends.
Primary smoking pertains to the person putting the cigarette in their mouth, lighting it up, and inhaling that smoke directly. Secondary smoke would be your child in the same room, sitting on the couch playing TV games while they inhale the secondary smoke that's coming off your cigarette. Tertiary smoking is something that a lot of people don't know about. That's when deposits of the smoke leave a residue on your curtains, on your couch, and that can also be carcinogenic. If you're not cleaning your house properly and ridding it of that residue, can cause long-term complications.
One of the reasons why smokers struggle to quit is because the habit is largely socially acceptable, making it easy for smokers to make excuses to continue.
Many people have different crutches that they use to fill a gap where there's a lack somewhere in their lives, or to deal with stress and increased pressures in the workplace. And smoking is one of them that help people cope socially with a bit of anxiety and a little bit of insecurity sometimes, to feel a bit more confident. And people are learning that there are other ways of dealing with that lack, or that lack of confidence. And it's no longer regarded just a social insignia. Certainly the health effects have become a lot more of an issue worldwide, and we're proud of that.
Quitting smoking is a struggle, and we asked some members of the public about their past and present smoking habits.
I'm a smoker. I most probably wanted to try, but it's the hardest thing to do is to stop. It's a bit of a commitment in yourself.
I've smoked cigars at one point in my life. I smoked about 3-4 a day, and now I smoke about 1 a week.
Smoked for many years, and I've stopped about, I would say now, nearly 15 years.
I have smoked, but mostly it was like socially. I might, like once every 6 months, I might have a cigarette because everybody else around me. So basically, I'm not a smoker.
Dr. Zelra Malan is part of a program which will train doctors in Brief Behavioural Change Counseling, a system which can assist smokers in quitting.
There's several options available for medical practitioners that they can refer their patients to, mainly internet-based self-help guides. There are also some support groups. There are medications that can be prescribed, or even self-help materials. But we do find that if the support by family and social groups, support by materials, and also medication is combined with intensive counselling done by the doctor, there's generally a 25% increase in success rate.
Brief Behavioural Change Counseling consists of 5 steps where a healthcare practitioner helps a patient decide for themselves that change is necessary.
Somebody that has a difficulty in changing a habit is usually stuck in ambivalence. And this means that he has a motivational tension inside of his head, where the one side is actually factors that causes him to think of changing, and the other side is factors that keep him where he is. So one of the goals of Brief Behaviour Change Counseling is actually to move with the patient to identify this ambivalence within himself and to help him resolve this ambivalence and move forward.
The first step to quitting is deciding you want to. With help from your doctor, family and friends, you can kick the smoking habit for good.
Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.